Bismillahirrahmanirrahim and Assalamu alaikum everybody. I hope you are doing good and taking care of yourself. You have revised your previous topics which we have done. We were doing the development of the axial skeleton. We did the development of skull, the development of ribs and sternum. Today we are going to do the development of vertebral column. Vertebral column is also known as a backbone. It supports your back, and through the vertebral canal passes your very important structure, your spinal cord. So vertebral column is comprised of series of vertebrae. You know, a typical vertebrae has a body, neural arches, laminae, transverse process, and a spinous process. So there are 7 cervical, 12 thoracic, 5 lumbar, 5 sacral vertebrae fused to form 1 sacral bone, and 3 to 5 coccygeal vertebrae fused to form 1 coccyx or a tailbone. These whole vertebrae forms your vertebral column. Vertebral column, before describing the development of vertebral column, you must describe the development of a vertebrae. How is a vertebrae formed? So the source of development of the vertebrae is your mesodermal germ layer and the paraxial part of the mesodermal germ layer. Paraxial mesoderm, you know, differentiates into structures, whorls of mesenchyme known as somites, and somites are going to differentiate into 3 parts: sclerotome, dermatome, and myotome. Myotome gives you muscles, dermatome gives you the skin, and sclerotome component is going to give you bones and cartilage. And sclerotome part is going to help in the formation of vertebrae here. So by the 4th week of intrauterine life, the cells of the sclerotome part of the somite, they migrate in 3 directions. They can pass ventromedially around the developing notochord, and this is going to form the bodies of the vertebrae. The cells meet the sclerotomic cells of the opposite side. So this is the picture. This is the developing neural tube, notochord. This is the somite. It is differentiated into dermatome, sclerotome, and 2 myotomic components. The myotomic components are going to give you muscles. Dermatome is going to give you skin of the back. While this component, sclerotome, we are concerned with sclerotome here in the development of the vertebrae. The sclerotomic cells are going to take 3 parts. Either they are going to pass ventromedially, and they are going to form this ventromedial structure, the vertebral body. Some of the cells pass backwards and dorsally behind the neural tube, and they are going to surround the developing spinal cord. They are going to form this vertebral arch and the spinous process. Some of the sclerotome pass laterally, and these are going to form the transverse process. So the sclerotomic cells take 3 routes: ventromedially, forming the vertebral body; dorsally, forming the this spinous process and the vertebral arch; and passing laterally, forming the transverse process. Some of the sclerotomic cells, you know, cross the lateral semitic frontier, and they are going to form the costal elements of your ribs in the thorax region. So vertebrae, when you are discussing the development of vertebrae, you must know that vertebrae passes through 3 stages: mesenchymal stage, quantification stage, and the osseous stage. In the mesenchymal stage, this mesenchyme is going to arrange around the developing notochord, this light pink structure, and this mesenchymal stage takes place by 4 to 6 weeks of intrauterine life. And by 6th to 7th week of intrauterine life, quantification centers appear in these mesenchymal structure. Quantification centers appears because they are going to form hyaline cartilage model. And this vertebrae, you know, is going to develop by, ossify by endochondral process. In endochondral process, mesenchymal first condenses, then hyaline cartilage models are going to appear, and these cartilage models are going to ossify and give you a bony structure. So quantification centers appears by 6th to 7th week of intrauterine life. Osseous stage, or the bony stage, takes place in 2 stages. First, primary centers of ossification develop. They develop by 7th week of intrauterine life, and they develop for the body and the transverse process. While secondary centers appears after birth, and they appear by 7 to 15 years of life. And ossification of a vertebrae is complete by 25 years of age. Now, knowing the development of vertebrae, now we can take that, how do vertebral column develop? While these somatic cells are going to arrange around the notochord, this is one somatic cell, one somite, sclerotome of one somite, sclerotome of the other somite, and they are surrounding the developing notochord. So during this process, a very important process occurs that is known as a re-segmentation process. This is known as a re-segmentation of sclerotome. What happens during this process, and what are the important changes? During the re-segmentation process, the caudal half of one somite, sclerotomic cells of one somite fuses with the cephalic half of the sclerotomic sclerotomic cells of the other somite. So one vertebrae is formed by fusion of caudal half of one somite and sclerotomic cells of one somite and the cephalic part of the sclerotomic cells of the other somite. So one vertebrae is formed by the caudal half of one somite and cephalic half of the lower part of the lower somite. This is going to give you one vertebrae. And what are the changes that takes place during this resegmentation process? These arrows are showing you the fusion and resegmentation process. The caudal half fusing with the cephalic half of the neighboring somite. And this is going to form one vertebrae. Before this resegmentation process, you can see this red structure, yellow, and this red maroon structure, yellow and red structure. This is your myotomic component of the somite, which is going to develop into muscles. This is the nerve supplying the myotome, and these are the vessels leaving. So the myotomes are just lying at the mid-level of the somite. Myotome and the nerves are lying at the mid-level of one somite, while the vessels are leaving between at the level between the two intervening level between the two somites. But once this resegmentation process is completed and once these vertebrae are formed by fusion, there is change in the placement of these muscles, nerves, and vessels. Now the muscles and nerves lie between the two vertebrae. Intervertebral region mein they are lying in between the two developed vertebrae, while the vessels leave midway between the one vertebrae through the intervertebral foramina. So the process of resegmentation results in the change in position in the placement of muscles, nerve, and vessels. Muscles come to lie between the two developed intervening vertebrae at the intervertebral level, muscles and nerves, while the vessels leave midway between the bodies of one vertebrae at the intervertebral foramina level. So myotomes are going to form muscles, and as they are lying between the two vertebrae, and these are going to help in the movement of vertebrae as a whole. Patterning of the vertebrae. Now you know the shapes of the vertebrae, they are different in the cervical region. Vertebrae is different from the shape of the thoracic, and the lumbar parts are thicker. What controls these shapes? The shapes of the vertebrae are controlled by genes, and the gene involved here is your Hox gene. So this is a picture from your KLM, Keith Moore. This is showing the notochord surrounded by the sclerotome of the somites and the myotomic component. So the sclerotomic component is going to form the vertebrae, and the caudal half of the upper somite sclerotome fuses with the cephalic half of the lower somite, and this is going to form one vertebrae. The notochord is going to degenerate. You know the fate of the notochord. Notochord degenerate, except notochord is going to degenerate, except it is going to remain in the region between the intervertebrae, and here it is going to contribute to the formation of intervertebral disc. And it is going to form nucleus pulposus of the intervertebral disc. You can be asked, what are the two components of intervertebral disc? Intervertebral disc is composed of nucleus pulposus, which are the remains of the notochord. Notochord is going to degenerate and disappear, but it is going to remain between the two developed vertebrae as the nucleus pulposus. And the remaining mesenchyme here is going to form collagen fibers known as annulus fibrosus. So intervertebral disc is composed of nucleus pulposus, which are the remains of your notochord, and annulus fibrosus, which are formed by mesenchymal tissue. So this notochord, it degenerates, it remains between the two vertebrae forming the intervertebral disc, the nucleus pulposus of the intervertebral disc, while the remaining mesenchyme here forms the nucleus, forms the collagen fibers known as annulus fibrosus. So the intervertebral disc has two components, nucleus pulposus and annulus fibrosus. These are the vertebrae formed by two somites. And this was a myotome. Now myotome is lying between the two vertebrae. It is going to help in the movement of the vertebral column as a whole. And these are the nerves. Now you know that vertebral column is not dead straight, not in a straight alignment. It is curved, slightly curved. When the baby is lying in the mother's womb, it is also lying in a C-shaped position. It is lying in a concave position. This is a this is a curve. So you have two curvature, primary curvature and the secondary curvatures. Primary curvature, as the name indicate, are the curvatures formed before birth, and the secondary curvatures are the ones which develop after birth. So there are two primary curvatures. Primary curvatures are present in the thoracic region and in the sacral region. The thoracic region primary curvature is concave, and sacral one is also concave forward. These are present before birth. But when the baby is born, it is lying. You have seen small babies in your homes and in your friends and families. They're just lying with the head straight. But with the passage of time, by 4 to 6 months, the baby starts to hold his head, move his head around. When the baby starts to hold his head, a curvature develops in the cervical region. This is the secondary curvature which develops after birth, and it is convex forward. And when the baby starts to take his steps, takes to walk, assemble his legs, lumbar curvature develops. And lumbar curvature is also secondary curvature. So two curvatures are present before birth and two are developing after birth. Primary curvatures are the ones present before birth, and they're present in your thoracic and sacral region. While secondary curvatures develop after birth, and they are present in the cervical and lumbar region. So in an adult, you have two primary and two secondary curvature. The cervical curvature is convex forward, lumbar curvature is also convex forward, while thoracic and sacral are concave forward. Coming on to the important clinical correlates relating to the development of vertebral column. So we have seen that the vertebrae develops from the two somites, upper caudal half of the upper and the cranial half of the lower one, and these two fuse to form one vertebrae. Vertebrae has a body, transverse process, and a spinous process. So what is a cleft vertebrae? Cleft vertebrae is when these vertebral arches do not fuse properly, and there is a gap left between the vertebral bodies. If this gap is very minute or little, then the child is going to just have a dimple at his back, and this is mainly present at the lumbosacral region, commonly present at the lumbosacral region. And when this gap is too little, that there are no herniation of meninges and spinal cord, so this gap is going to be covered by skin, dermis, and these hair follicle. There is going to be a tuft of hair. This is known as spina bifida occulta. The newborn has no neurological deficit in this condition. But if this gap is a little wider gap is going to cause herniation of the meninges, dura, arachnoid, and pyometer out. The meninges are going to herniate out, and this is going to form the sac-like structure. This is known as spina bifida meningocoele. But if this gap is more wide, it is going to cause herniation of spinal cord and spinal nerves along with the meninges. This condition is known as spina bifida meningomyelocele. So spina bifida cystica or spina bifida cystica occulta, spina bifida with meningocele, spina bifida meningomyelocele. Meningomyelocele is a severe defect. It can cause neurological deficits in the newborn. This condition, spina bifida occulta and cystica, can be diagnosed prenatally by ultrasonography and by amniocentesis of the mother. In the amniotic fluid, there is going to be raised alpha-fetoprotein levels. And these defects can be treated by surgical procedures. The cleft the defect is then treated surgically, flaps are made, and the defect is closed by skin and dermis, and the nerves are placed back into the position. But if those defects are not treated, there are going to be neurological deficits in the child. He's going to have neurological deficits. And to prevent these defects, the mother is advised to take folic acid during preconception time and during the conception and during her pregnancy. Folic acid is very important to prevent these defects. Another defect in the development of vertebrae is hemivertebrae. Hemivertebrae means half vertebrae. As you know, the process of development of vertebrae is complicated. One vertebrae develops from contribution by two somata, from the caudal half of the upper and cranial half of the lower one. So if these the half is not developed, one somite does not fuses with the other half, it is going to result in a hemivertebrae, half vertebrae. And this half vertebrae is going to result in a lateral bending of the vertebral column. This is known as scoliosis. Kipple-Field sequence, it is another important clinical correlate. What comes to your mind? What comes to your mind when you see these pictures? You see the baby's neck is just attached to the thorax region. So the baby's neck, there is some problem in the baby's neck, and the baby's neck is maintained by your cervical vertebrae. In Kippelfield sequence, there is some abnormality in the formation of the cervical vertebrae. One or two cervical vertebrae are absent, so resulting in a short web neck. Abnormal curvatures. Now we have done with the normal curvatures that there are two primary and two secondary curvatures. Curvatures are present in the cervical, thoracic, lumbar and sacral region. Abnormal curvatures are scoliosis when there is abnormal and increased lateral bending of the vertebral column. It can be due to hemivertebrae. Kyphosis is when there is exaggerated increase in the thoracic curvature. This can be present in the patients with rickets. Lordosis is when there is an increase in the lumbar curvature, and these are normally present in pregnant ladies as well.